Guys, hope the NEET MDS preparation is going on in a positive pace for all the NEET MDS aspirants, and I wish a very good luck for all of them who are going to attend the exam. So, in the previous video, if you would have seen, I would have posted a video for 4 months timetable. So, 4 months timetable will cover all the full portion, and it would have been ideal if you had followed the timetable during the first time, and again you could have again followed it if you started the timetable around June month, July month, August, like that. But for those who started during the September month, it was going on in a good pace, but with the announcement of NEET exam to be conducted in December 16 itself, some students have started panicking whether if we sit with the full portion timetable till the end of the year, will we get time to revise the exam. For such queries, I have just squeezed in the 4 months timetable into a simpler 75 days timetable. So you can do the 4 months full portion itself in 2.5 months. I have not cut down any topic, I just have squeezed the topic. So if you clearly see the 4 months timetable in the previous year video, you would have seen some dates and all. There are only few smaller topics, and some dates would have had topics like part 1 and part 2. So those here and there, I have slightly shortened the time span so that we cover it in 75 days. So I'll be explaining the 75 days timetable, and for the last minute preparation, if you find that covering the full portion, sitting and wasting the 4 months timetable in 3 months, if you are very doubtful about completion of the 4 months timetable, I recommend all of you to use the 75 days timetable. And those who have finished with one full round of 4 months timetable, you can as well use the 75 days timetable. Those who are in the middle of your 4 months timetable, you can slightly try to skip the last 3 or 4 weeks of your 4 months timetable, and you can directly switch to the 75 days timetable, because anyway I have added many topics again and again for revision. You've got time for exam paper revision, everything in the 75 days timetable. So for all the NEET aspirants who are going to write NEET examination, it is better to switch your 4 months timetable to 75 days timetable. Whoever you are following your previous timetable, the same timetable with slight rescheduling, wherein I have mingled few subjects. There is no week, one single week which is allotted to one particular subject. I have mingled few subjects so that 2 days you'll have one subject, after 2 days you have another subject. The reason behind that is only when you switch many subjects, you will get time for revision of the subject. So now let's get back to the timetable proper. In the previous videos, I have explained a little bit in depth about the examination and the pattern and everything. So I'm not going to explain in depth about it. So this tentative exam date was posted in the NBE website, and according to the website, the tentative schedule is 16 December. Again, a reminder, it is not the finalized date, it is just a tentative date. So most probably when they post a tentative schedule, the original exam date also will fall on the same date. So let's just assume that the exam is going to be 16th December 2020 for the batch which is going to start their academic year, PG year for 2021. The syllabus, it has part A and part B. Part A is comprised of all the medical science subjects, and part B is comprised of all the dental science subject. You can see the previous video for depth explanation of the NEET MDS syllabus. Paper evaluation, for every correct response you'll get 4 marks, and for every incorrect response it is -1, and if you leave the question unattempted, it is going to be 0 marks. Coming to the 75 days study plan, the 75 days study plan itself I have divided into first 45 days and last 30 days. So first 45 days is the proper timetable. So those who are joining the crash course will start from October month. So October month onwards, we'll have morning we'll send the discussion for the notes following the timetable, followed by an MCQ discussion in the morning, and in the evening time we'll be having alternate days Skype webinar session, and in between the days where we don't have webinar, we'll have MCQ discussion in the night time. The MCQ discussion will be screenshot from the previous year examination question paper and the discussion for each and every question. So that way we'll run the crash course from October month. So the timetable, if you see the timetable, it is the same thing which has been copied from the 4 months full portion timetable. Some topics here and there would have been missed out, but all the topics, they will be added along with the main heading. So for example, if some topic which I have split it into part 1, part 2 like that, I would have just given as one single heading. So one single heading alone, I'll be compiling everything. If you see in the next slides, there is just one date for RPD. In the older timetable, it would have been split into surveyors in one particular day, major connector, minor connector in one particular day, rest seat preparation another day. So in one single day RPD, I'll be posting all the notes related to RPD. We are trying to squeeze in, but even if you cover all the full portion also, I'm going to send only the very important notes. So if somebody is not very confident about what if we end up with nothing by trying to study full portion, it is kind of wrong, because only the must know from all the topics, the topics which you cannot afford to miss, only those topics I'll be posting in that discussion. So important topics I have put for 45 days. I'm running it a little faster because the full timetable along with the PDF is available in the website. You can download the timetable, and you can even take printout of it, so that once you are done with every day, you can put a tick mark. And towards the end of the PDF also, there is assessment form where you can at least download the assessment form alone, and you can self-assess yourself. Then after 45 days, so the serial number which I have added, these are all the day 1, day 2, day 3. So like that, after 45 days, if you see, we have exam paper discussion. So those days are exclusively for the revision of your exam paper, as well as the mock exam which we have in our crash course, as well as the main batch, mid-year batch students. All the mock exam paper discussion will be exclusively done after the 45th day of preparation, that is from 15th of November. So from 15th November to 15th December, there is solid 1 month of revision. The 1 month before exam is going to be purely discussion. So after a exam paper discussion, in between I have allotted few days for revision. So that revision days is for complete revision of all the discussion notes. So that time you can reduce the number of MCQ, and you can increase your time spent for revision of the topics which you studied. And again, I have added exam paper discussion, and towards the end, that is exactly 10 to 14 days before your exam, I have added one particular week exclusively for important topics, important subject. So the important subject which you cannot afford to miss includes oral medicine and pathology, because oral medicine and radiology is 15 question, oral pathology is 15 question, which means 30 question will come only from that topic. And apart from that, general medicine, general surgery, oral and maxillofacial surgery again revolves around this oral medicine and pathology. So if you just study this topic thoroughly, 15 plus 15 plus 15 plus 15 plus 15, which is around 60 to 75 question will come from only this particular topic. So you can never ever miss this topic. Then after that comes a dental materials, endo and prosto section. So dental materials again 15 question, endodontics and conservative dentistry 15 question, prosthodontics 15 question. So 45 question itself will come from that whole chunk. Then you have a separate chunk called ortho. So ortho, you have 15 question, and some of the pedo question comes from ortho, endo and preventive dentistry. So if you study endo, part of pedo is covered. If you study ortho, again part of pedo is covered. The remaining part of pedo which is left out from endo and ortho is child psychology and preventive dentistry. So preventive dentistry, most probably 3 or 4 question will come. 2 or 3 question will come from child psychology. So in case if you are very much confused about child psychology, you can omit the topic. Then the next chunk of group is the anatomy. So when you study anatomy, you have 15 questions coming from anatomy, 15 from general surgery, 15 from oral surgery, and 15 from oral anatomy, tooth morphology. So everything again revolves around anatomy. So another 60 question is from the anatomy oriented subjects. Then you have a separate group called review of all system. So when I mean review of all system, I mean the cardiovascular system, GIT, renal system, endocrinal system, central nervous system, like that. Of which if you are not able to cover all the system, at least endocrinal system, cardiovascular system, respiratory system and GIT. These 4 systems you cannot afford to miss. So if you cover the review of system topic, you will cover physiology, you will cover general medicine, you will cover general pathology. So in that way, 15 plus 15 plus 7 from physiology. So you will easily cover 37 to 40 questions from review of all system topic. And towards the end, last is a perio and PhD. So PhD, though you find PhD is little tougher, again 15 question comes from PhD, of which around 5 to 6 question is from preventive dentistry. So when you study the preventive dentistry topic from perio itself, 6 question from PhD is covered already. Then perio is mainly all about gingivitis, periodontitis, all those things are indirectly covered in oral medicine as well. So if you study the oral medicine, oral pathology chunk, you will be covering perio as well. So these subjects are the very important subject. So if you see clearly, I would have totally skipped microbiology and biochemistry, but without your knowledge itself, when you are studying the review of system, you will be covering a part of pharmacology. For every system treatment, when you study pharmacology will be covered, inadvertently pharmacology will be covered. So you don't need to put a separate day for studying pharmacology. And along with that, the diagnosis part, when you study biochemistry and microbiology will be covered. So I have not allotted a separate day for pharmacology, microbiology and biochemistry. When you study these topic itself, you will cover your full portion for NEET MDS. So the last 10 days I have exclusively allotted for subject. Then if you see towards the end, I have again added previous year paper revision. So the 4 days of previous year paper revision is for exclusive revision of all the exam repeat question. Then towards the end, there is third round of revision of oral medicine. But instead of just subject vaguely as oral medicine, I have put the topic as important lesion part 1 and part 2, which means any lesion, be it oral medicine related, oral surgery related, general medicine related, whatever it is, any lesion you come across. Lesion, I mean, is all the growth, tumor, some blister, anything, red and white lesion, pre-malignant lesion, anything. All the disease pathology related you will be covering for 2 days. That is going to be a grand revision for the entire chunk, which carries almost 60 to 75 question. Then basic sciences important points, one particular day will be allotted, wherein you will be revising all the anatomy, physiology, must know topics from basic sciences. Then one separate day for all the mnemonics you have studied so far, and one separate day for all the classifications you have studied so far, and one particular day for all the numerical values. Then lastly, towards the end, previous year paper revision you will be doing. So last 1 week I have exclusively allotted for exam paper revision, and you will be done with your effective 75 days of preparation. So mode of preparation, all these things I have explained in the previous video on how to prepare and how to switch or how to do your MCQ preparation. So this I have added in the slide so that when you download the PDF, all these points also will be downloaded in the PDF, because the subject group, when you are mixing the MCQ, please check out the previous video on how to do the MCQ preparation, so that when you download it, it will be easy for you to club the MCQ preparation. Then the assessment sheet is also available in the PDF, that also you can see. So be very confident, do your preparation properly with some systematic plan, and you will definitely achieve greater heights. Good luck for all the aspirants, and if you are interested in joining the crash course, ping us in this number so that we give detail about what is crash course advanced and what is crash course light, because crash course advanced is going to be a complete full course preparation, which includes daily discussion notes in the morning and daily MCQ discussions in the evening with alternate Skype webinars, whereas crash course light is for those who are already doing their own preparation, but they just want some guidance here and there. So for such students, you can go for a lighter version, wherein you can do your own preparation following the timetable, but you will be added into a WhatsApp group where we will be having daily rounds of MCQ. So daily there will be somebody or the other who will be sending you MCQs, and discussion of very important basic MCQs will be done in Crash Course Light group. So depending upon what is your preference, you can join the Crash Course accordingly. Thank you everyone.